and you're going to want to make sure that you can see in the mouth really well.
Okay.
So I didn't put barriers on this or this because everything I'm doing is extraoral. I would wait to put the patient's bib on before you do the extraoral exam because again, you're trying to get to the clavicle and feel for the lymph nodes there. If you have, I can't remember ever having maybe a tie, but if they have on a tie or whatever, you have to have them loosen that and do that. Most of them don't do that either.
They're not as cooperative, are they?
Can we videotape this?
I already got it.
Yeah, that's what she's doing, yeah. Oh, thank you. Yeah, that's
All right, Taylor, you're in a good position.
Yes.
You read for me. All right, so if you recall, when you're coming in with your patient, you're observing them from the reception area coming back. You're looking at gait. You're looking at, any like drooping, anything like that. You're just observing them coming in. Please, if they're a little slow walking in, don't just be around the corner before you realize that you walked off and left your patient, because they don't know where anything is in here, okay?
And
So
when they go to the bathroom, you might want to stand ready to bring
You
them back.
will probably stand near that door to watch for them to come in. So you brought your patient in, you greeted them, you've done your medical history review and your vital signs. You have had an instructor come over and sign off on that. And the next thing that you'll be doing is your extraoral exam, okay? I'm bringing you up and you'll see. Up a little bit and down a little bit. Okay, so the first thing I'm going to do is
You're going to explain the procedure and the rationale to the patient.
so Mrs. Grubbs, today I'm going to do an extraoral exam. We're just feeling for lymph nodes, any palpable lymph nodes. We're looking for any lesions. We're making sure everything is good to go, okay?
And then you're going to place the patient in an upright seated position. And then you're going to perform hand hygiene prior to the procedure.
Yes.
And then we're going to don PPE in correct order. Have patients remove eyeglasses and loosen collar for examination of the neck.
All right, so she's done both of those for me. She already took her glasses off, but have them take them off. Make sure that you can get to seeing the thyroid area and you can access the clavicle to feel lymph nodes.
Okay, so first we're going to visually examine overall appearance.
So we've watched them coming in. We're going to look for any asymmetry in the face, anything like that. If you recall with that video, it's kind of looking at the forehead and then the eyes and then the nose area and then the chin, right? Okay.
And then we're going to visually inspect the head, scalp, and ears.
Right. So again, some of your patients you're going to be able to. I'm not
hair.
gonna touch
Right.
your hair. But some of your patients you'll be able to see that you don't have to take a patient with a full head of hair and start going through their hair. Okay. But you do want to move the. Move the hair back to observe their ears on each side. Okay.
Okay, sorry. Okay, and then we're moving to the lymph nodes of the head and neck. So first we're going to palpate bimanually and bilaterally occipital nodes.
All right, so have your patient lean their head forward. If they have long hair, you're going to have them hold it up. You're going to start from in the middle and work your way towards the ears. Circular motion, and I'm using both hands at the same time. Now these lymph nodes can be in different places, so I'm going to do this in a couple of spots. So kind of in the hairline and then right under the hairline. Again, it is a circular compression. Please don't do this or this, okay? All right, circular motion to the ears, from the midline to the ears in 2 areas.
Okay, so then we're gonna palpate bimanually and bilaterally preauricular lymph nodes by applying circular compressions with fingertips.
All right, so your book showed you to do them individually, but you can put your fingers in the front and do these at the same time. So these are the preauricular, right? And then I can go on around to the post-auricular. Lean your head forward just a little for me. Good. And again, you're starting from the front of the ear, circular compression all the way down, and then behind the ears, all the way to the top of the ears.
Are there certain fingers you're supposed to use?
You're going to use
Okay.
these two to three.
Okay.
Okay, then we're gonna palpate manually submental lymph nodes using digital compression with thumb and index finger.
Okay, so go ahead and lean your head forward again for me. So what you're going to do here, thumb and index finger, put your thumb here, and you're going to palpate underneath the chin. Okay? Did you get that?
Mhm.
Okay.
Okay, and then we're gonna palpate bimanually submandibular lymph nodes by rolling the tissue over mandible with a push motion with one hand and pull motion with the other hand.
All right, so this one is a lot of times where, for myself, I usually will, if there's a palpable lymph node, that's where I'll find it. So you're going to use both hands. One hand, you're going to take the tissue here and push it towards the side you're working on. Can you see how I've kind of pushed over the tissue a little bit? This hand, I'm going to take these fingers, kind of cup underneath the jaw, take my thumb here, and I'm rolling that tissue over, up and over the jawline. Don't just pull it up and then let go. Follow back down. You can come around this way if you need to see. Then I'm going to take these fingers and I'm going to push the tissue this way. Same thing. Use these. Don't do it like this. You'll just slip up over. So use your fingers to kind of cup the jaw and roll it up and over. And usually that's where you'll get a little, if there's a palpable lymph node, it will kind of like pop over the jaw. And the patient will tell you they feel it as well. And if you get it, don't just keep going over it because it will hurt a little bit, okay? So you've done that on both sides. Again, the main thing is to push over tissue so you can get it. Use the tips of your fingers, cup underneath that jawline in order to have that tissue roll up and over with you, okay?
Okay, so we're gonna palpate by digitally cervical lymph nodes medial to the muscle by grasping muscle and rotating fingertips back and forth over muscles. Cover entire length of muscle from ear to clavicle.
So that's your sternocleidomastoid, right? So what you want to do is have your patient upright like this, have them turn to the side and put their chin in your palm. And that will kind of relax that muscle a little bit. Find that sternocleidomastoid. Again, put your thumb behind and these 2 to 3 fingers in the front, and you're rolling the tissue up and over that sternocleidomastoid. This is doing it anterior to it. Go from the ear down to the clavicle. So all the way through. And you don't have to pinch them and push real hard with it, okay? But you do want to make sure that you have that to be able to roll over. That's anterior to the muscle. Posterior to the muscle, you're going to find it. You're going to put your fingers in behind that muscle, and you're going to do a circular compression from the clavicle up to below behind the ear. All right, so again, hers is very prominent. Sometimes it's a little hard to find that muscle. So if you've got like a big person and you're having trouble finding it, then have them put their chin down a little bit. That's going to help you locate that muscle better to be able to do that. You're going to have them do the same thing to the other side. Put your chin down for me. Again, hers is pretty easy to see. I'm going to start up at the ear and I'm going to roll the tissue over that muscle and then behind it. I'm pushing kind of against that muscle, the back of the muscle, and doing a circular compression here. But I'm not putting a lot of pressure to it, right, Mrs. Grubbs?
Mm-hmm.
All right. Yes, I am.
No.
Oh, okay. All right. So we've gone through the occipital, pre and post auricular. We have done the anterior and posterior cervical chain. What's next?
Okay, so we're gonna palpate bimanually and bilaterally
Clavicular.
lymph nodes using circular compression.
Okay, so again, you can have them just kind of, make sure that they've moved that away. You're gonna start, you can sit behind them. I'm gonna do this, you can do them one at a time, but I'm doing both. Again, I'm using pointer and middle finger here. And again, I'm pushing, kind of compressing against the clavicle, but you've got lymph nodes up against that clavicle. So just from end to end. And feeling for any palpable lymph nodes. If you feel any palpable lymph nodes in all of this, you want to note that in your charting. Okay?
Okay, and it just says that we need to be able to identify all of those nodes that we just went over. So now we're gonna go into the salivary glands and thyroid gland. So we're gonna palpate bimanually and bilaterally parotid glands using circular compression.
Okay, so where are the parotid glands located? Okay. So you can take your hands like this with the patient's face. If they have any makeup, it'll be done when you're done, right? And you're just gonna do a circular compression to feel for any hardness of that parotid gland, okay?
Okay, so now we're gonna locate the submandibular glands by finding the antegonial notch. Ask the patient to press the tip of the tongue against the roof of the mouth while compressing the glands upward against the tense muscles.
All right, so if you run your finger along the mandible, you feel that little indentation notch. That's the notch you're looking for. Once you get to that, then you're going to walk in from that to underneath their chin. That puts me where that gland will be. I'm going to ask my patient to, ask my patient to put their tongue to the roof of the mouth, and then I'm just going to compress upward. Okay?
Okay, so now we're gonna locate the thyroid gland below the thyroid cartilage. Ask the patient to swallow a sip of water if necessary to facilitate locating the gland. Keep hand in a stationary position. Manually palpate the gland as patient swallows a sip of water.
Do you need a cup of water? You can get a good swallow for me? Okay. So if you remember that thyroid is a little butterfly shaped gland. The easiest way to locate that is most people will have like a little crease, if you will, here and right here. It should be between those. All right? So what I'm going to do, just put your chin back down just a little bit, right in there. Okay, so I'm going to look at that and determine this is the area where her thyroid is. What I'm going to do is press in with one side, palpate with the other, and ask the patient to swallow. Easier said than done, right? Then I will do the other side. So I'll kind of push in with this side, palpate with this one, and again ask the patient to swallow. Great. And what I'm going to do is feel for, I should not feel that thyroid gland. So if I did feel it, if it looks swollen in that area, if I feel a hardness in that area, I am going to note that and ask the patient. Now you may have a patient who has thyroid disease, and yes, theirs is definitely palpable, but if they're under a patient's or doctor's care, okay, they're having those levels checked, etc., with the doctor on a regular basis. You're going to ask them. You're going to know from their medical history too. But anyway, okay. And if not, you're going to not keep it a secret from your patient, but you are going to ask them questions. Has your doctor ever said anything about your thyroid gland? It feels a little, oh yeah, last time I was in, and they told me that I'm going to go back I've got an appointment in a couple weeks to have, follow up with that. Then you're good. You just note that, right? If not, you've informed the patient to follow up with their physician about it. Okay?
I have a quick question. What if they are informed by a physician, but they tell you, I'm not going to worry about it?
again, all you can do is note it.
Okay.
Noted that the thyroid was enlarged, which lobe of it, or the whole thing. Ask patient, but you document.
Okay. I just didn't know if it changed whether or not we could see them or things we could do to them.
It shouldn't, until, the only thing that we would be concerned about is there can be a contraindication to anesthesia if they have a hyperthyroid. So it can create something called a thyroid storm. So that, it might get a little more of an issue there.
Okay.
All right?
Okay, so we're gonna do the TMJ now. So we're gonna locate the joints near the tragus of each ear and palpate bimanually and bilaterally. As patient slowly opens and closes mouth, it makes lateral excursions to the right and left.
Okay. You might want to come this way because I'm
Okay.
going to stay in front of her. Okay. So I'm going to come to the front of the patient, ask them to turn towards me. I am going to find